Aging and Awesome. You know, hospice is something that we all have a lot of questions about. Exactly what it provides, what it costs, when it's time to actually consider it. And Eden Hospice has the answers. So Dr. Reed Doff is here to try and explain some of the problems that we might want to look at and some of the questions that we have. Thank you very much. You're the medical director over at Eden Hospice, right?
I am.
What do you do? What is that?
Well, I work with your physician to come up with care plans to make sure that we're promoting comfort, quality of life when families and patients are dealing with serious terminal illness.
So you're kind of like the bridge.
Sure.
Yeah?
I'll be a bridge.
Well, what's the difference between hospice and being in just like home care?
The focus of care. Home care, home health, those are really focused on rehabilitation, recovery after illness, restoration of kind of where you were before that thing happened. Hospice changes the script a lot. It focuses on management of life-limiting, serious terminal illness when life expectancy is no longer measured in years, but months.
And instead of trying to save a life, now you're trying to help someone out, right?
We're trying to manage all of the things that come up that patients and families deal with when we have to focus now on the dying process.
Is there a typical amount of time people are in hospice?
There's a rule
Okay.
That's really more of a suggestion. When your physician or healthcare provider can estimate a life expectancy of 6 months or less, it's time for hospice. It should have been considered far before that.
So what's it like dealing with all the people that you deal with? There's probably a lot of explanations.
It's a lot of explanations,
Yeah.
a lot of support, a lot of gentle conversation, trying to meet people where they're at, what they understand. It's incredibly rewarding, and it's, for me, the best part of medicine.
Thank you.
You're welcome.
Does anybody here have any questions about hospice that they'd like to ask?
Dr. Duff, I'm so glad you're here. I've thought of hospice as something that takes courage in order to request. Do you find more men or women which are more prone to invite themselves to hospice?
Thank you for that question. In my experience, it is women who are more comfortable and forward in talking about their healthcare concerns in general. But hospice is also the great equalizer. So when it's time, everybody is kind of made to ask those questions.
When you go to hospice, there's got to be some benefits for the families and the caregivers. And what's that look like in hospice?
I think one of the most important aspects of hospice is that there's always a nurse, physician, other members of your care team to talk to reach out when things arise. There's also a great deal of education that comes from all of the different team members who can really prepare families, caregivers, and patients for what will come. And then after the process too, there's a lengthy bereavement support that goes on to help people recover.
And how is it paid for?
Most insurance will have a benefit for hospice for their members. Medicare, Medicaid provide hospice services to their members as well.
So it's just one more thing you can take advantage of, get some help.
And you should. It is really the standard of care.
Okay, thank you so very much.
You're quite welcome.
Dr. Reed Doff, thank you so much for being here.